Hey, I'm Dr. Seiler from Seiler Skin in Birmingham, Alabama, and we're going to do a total FX CO2 treatment on a good patient of mine. She's actually had this treatment before years ago and was really happy with it. It's a great treatment for fine lines, wrinkles, texture. We're going to show how comfortable she is during the treatment. She's had a little bit of oral medicine to relax her. I'm about to do a little numbing shot inside of her mouth. It's really easy to get through, and that'll make this area of her face completely numb. So we're going to do the little numbing shot first here. And then we're going to do her face and her neck with the CO2 laser, and then we're going to do IPL on her chest and her back just for pigment. Okay. We have a great little lollipop that's got some strong medicine in it that makes patients really nice and comfortable, so you usually don't feel anything during the treatment. Okay. She's had this done probably 5 years ago, I guess. I think 7. She got a really good result from it, so we're going to do it again for her. So that's the numbing shot on that side. Get a deep FX on your nose now. This is the deep part. Here we go. You ready? Is that okay? Fine. So this is the deep FX, which is the first half of the total FX CO2 for deeper collagen tightening. Probably can't really see on the video too much change in the skin, but you can see it if you're me. You can see that I can do this pretty quickly, so the patient is very comfortable. She's probably not feeling too much right now. Some of our medicine has kicked in good too, so she's nice and comfortable. Do the deep on her forehead, and we're going to do it around her mouth. And we're going to do the more superficial treatment on the whole face, and that way we get the eyelids nice and tight. Doing okay?
Very comfortable.
Feeling much?
Not hardly anything.
Good. So this is a very, very small spot size, so that's why you can't really see much change on the skin. You can see the little white dots where the laser's going in. Just kind of fade it into the outside here. I'll leave the upper forehead alone and do that with the more superficial part. Do a little bit more on the nose. Do a little bit on the nose right here. Alright, we're going to do around the mouth now. Sorry. Get right onto that little lip right there. Be real still for me. This usually gets deep enough to cause just a spot or two of a little bit of bleeding, which is no problem. It means we're getting good and deep. Go all the way out to the jawline when we do the deep. We get the corners of the mouth really good. Doing okay?
Doing great.
Good. Piece of cake, huh?
No discomfort.
Good. So this is the part that really helps to tighten the deeper lines around the face, around the mouth. Especially in the corners of the mouth. We can always come back and put a little bit of filler in there. And Botox in the upper face will help keep the lines away. Her skin's in really good shape, especially since she's done this once before, so she's going to heal really quickly from this. Alright, be real still for me. We're going to do the upper lip. The good thing about this laser is I can go all the way onto the lip line. Kind of tighten those little fine lines around the mouth. And I can kind of move with it a little bit to kind of fade it into the cheek. Once we're done with the deep FX, we'll switch to the active FX, which is the more superficial one that helps with crepey skin and pigment and fine lines. You'll see me do a pretty strong treatment around the eyes here in a minute. Okay? Good. That numbing shot that I do before the treatment, which the patient barely feels, really helps them make this whole area almost completely numb. So usually the patient doesn't even really feel it. Are we leaving your little mole alone?
It's up to you. If you think you can
You want me to shave it down a little
shave
bit?
it down, that would be great.
Alright. This laser will remove moles too, so you'll see a little later in the video we'll remove that little mole on her upper lip there. I'm going to switch hands now and do it the other side. Alright, that's it for the deep. We're going to switch hand pieces here in a minute. But now this is the more superficial. You'll see this a lot more on camera. You'll see the little white specks of little vaporized tissue here. We're going to start right here. You ready? Here we go. Right on the tip of your nose. Okay?
It's hot.
Forehead is the hottest part. Once I'm done with the forehead, then the rest of it will be easier. Bear with me here. We'll get you through it. She's tolerating this really well. If you were standing right here, you'd be able to see the skin really shrinking up with this. Once we get off the forehead, then the rest of it's usually a piece of cake, so I do that pretty quickly.
Okay.
The good thing is with this laser is we can get all the way into the hairline without causing any problems, so we can tighten the skin all the way up into the hair. Doesn't cause any hair loss. This is not the laser we use for hair removal.
Can you explain what the white is on this?
Yeah, so the white, this is a CO2 laser. This actually vaporizes tiny little holes of tissue. So we're actually kind of taking off a fraction of the top layer of the skin. And so the little white flecks of skin right there are little bitty vaporized dots. That's why you can see a little bit of plume coming up with the smoke here. Alright, we're going to do the chin. This will be a little bit stronger. Should be pretty good and numb down here. Usually the forehead's a little hot, but not too bad. Once we get through the forehead, then the rest of it should be easy. And for those of you that may be watching this for training purposes, for my physicians out there, you'll see that I'm moving really quick with this, and I've done almost 700 of these, so at the time of this video, so I can get this done quickly. The patient's not moving too much at all. Once we get around the eyes, it'll start to be a little hotter. Finish off the chin here. So this is actually removing just a little bit of tissue. What helps with the pigment and the more superficial tightening. Okay, tilt all the way to the right for me now. There you go. I'm going to finish off the jawline. I don't know if you can pick it up on the camera, but if you got real close, you might have to wait till we get to the other side. You can actually really see the skin just shrinking up. It's pretty cool. My favorite part of this procedure. We can actually even treat the earlobe. Okay?
You did.
Bear with me when we get around the eyes. It will be a little bit hotter, but should be fine. I turn to the left now. I'm going to finish off the eyes with a little bit different setting here in a minute. So let's see if we can get in real close, maybe from this direction. You can see you can really see that skin shrinking up. If you look at the other dots that we've already fired, you can see that skin really shrinking, which the patient likes to hear.
Yes.
All right, let's turn straight again. I'm going to do just a little bit different setting around the eyes here. Alright, so let's tilt your chin down just a little bit. There you go. You're going to pick up this one eye shield, make sure your eyes are real good. You're going to feel my nurse Kate.
Lost focus.
What's that? Now we're going to do the super strong treatment on the eyes here. I'm going to get this nose one more time. And if you can get in real close here, you can see the skin just shrinking up when we do this. Pull down real good for me. You can see that I can actually do this very safely without having to put the eye shields on the eyeball like we used to have to in the operating room. We can get all the way to the eyelash with it. Here we go. 1, 2, 3. Bear with me. It'll be a couple shots here. Hopefully you can see it on the camera, but this skin is really shrinking up. One more shot. Alright, good. Alright, tilt to the left a little bit. Let's do this side now. I'm going to wipe your eyelids here, make sure you're good and dry. Alright, Kate's going to pull down on the cheeks there. I think you ought to be able to get a good look at the skin tightening here. I'll slow down a little bit so you can see it. See that skin just really shrinking up. Alright, pull down real good for me. I'm going to do 2 more little shots under the lid here. Alright, good. Now let's pull down on the forehead. See if you can move your hands a little, just a little bit. There you go. Yeah, do that. There you go. Now let's see if we can pick up the tightening here. Pull that real good and tight. Alright, good. So we're done with the face.
Nice.
Alright, good. You okay?
Yes, I'm doing great.
Good, good. And she would tell me, she's being honest. So we're going to take a break for just a second. We're going to put some cold washcloths on her face, and then we're going to do the neck next. All right, so now we're going to use the CO2 laser here real quick to remove this little mole.
Still not in focus.
As soon as we get in focus here.
Okay.
I'm going to do this right here. Be real still for me. You see that it just takes that mole right off. I'm going to change angles here. That's it. That mole will be gone once she heals up.
You already did it?
Yeah.
Wow.
Alright, so now we're going to do the pretty aggressive active FX, which is a more superficial treatment on her neck. You'll see this. I'm going to try to stay away from the spot size here. Okay?
Yes.
Not too bad?
Very gentle.
Very good. Lollipop makes a big difference, doesn't it?
Yes, sir. That is a beautiful thing.
One thing my patients know is that I'm good with anesthesia. I make them good and comfortable. They're not hurting when I do this, so.
And we love you for that.
You can also see how quickly I can do this. I mean, it's really fast. I'm actually firing this as fast as the laser will let me. The only reason why I'm not doing it faster is because it can't fire any faster. Needless to say, I've done a couple of these over the years.
Would you like to talk about the difference in this CO2 at all?
Yeah, so the CO2 is, in my book, is the best. It's the best procedure out there. I think this laser is still the best of all 7 or 8 different CO2s. It's got the best dynamics to go deep enough for it to do its thing, but it fires so fast that it does not give you as much downtime as some of the other CO2 lasers. Fraxel, which is a laser that we use for kind of a medium treatment, is still a good treatment, but CO2, you just cannot beat the results for pigment, for lines, wrinkles, for tightening, texture. Alright, now so you can stay there. I'm going to come on this side over. Alright, we're going to start right here, and I'm going to finish off the neck. She's actually got a little bit of an ACD scar. She had a little neurosurgery procedure there that healed up really good because she's been using some of the Skin Medica products. You've been using the essential serum and the scar recovery gel, haven't you?
Yes. Which has helped.
So that's really helped a lot. I'm going to get a little closer to your neck here. I'm going to finish off your chin. And again, the little white flecks or little bits of vaporized tissue to help remove little fractions of skin. That's why this is called fractional CO2. Much safer than traditional CO2 that was a lot more aggressive on the skin, and I have never had a complication with this procedure. I've done this just over 700 times, so got a lot of experience with it, and patients have gotten a lot of good results over the years, including our patient here who's already done this once. Finish off the neck here. You can see how quick of a treatment this is. Tilt to the left for me just a little bit. There you go. And you can kind of turn it onto the back of the neck here, so we kind of tighten that little back of the neck skin there. Alright, so that's the end of the CO2. Awesome. Stay tuned. Alright, so now we're going to do IPL on our patient's shoulders and chest here. Eventually we'll do her back. So this is a different device. This is IPL. This is intense pulse light. Unlike a laser, it uses multiple different wavelengths to target different colors instead of water. So this is much more for browns and reds. So spider veins, sun damage on the chest. We're going to kind of fade it, since we're not doing her entire arms, we're going to kind of fade it into the shoulders here so we don't have a line. And this should be a piece of cake. This is generally tolerated really well on the chest. We can go right up to where we finished the CO2 laser on the neck there, so you can kind of see where she's still a little red right there from where we did the CO2. You doing okay?
Great.
Not too bad?
No, not bad.
We love the lollipop.
Really, that is a huge...
I don't think we had that when you did it
No.
7 years ago. I think I only started using that maybe 3 or 4 years ago. It's very safe, but it's very strong medicine that really makes you good and comfortable. So,
The funniest thing, though, I thought it was some sort of medical, slang. I didn't realize it was an actual
yeah, it's literally a lollipop. It's really a lollipop that's got, we get it from a compounding pharmacy in town. They've had lollipops for kids forever for sedation in the ER. And so they put stronger adult medicine in it for this kind of thing. And alright, so that's IPL on the chest. We're going to finish off her whole chest here to kind of cut the video short, and then next we'll do her back. Alright, so we're going to do IPL on the back now. I'm going to start kind of lower down here so you can kind of see this. This is just to show the ease of this treatment. We've got a bunch of before and after pictures on our website of what this can do. We actually just got some really good before and afters of a patient today that finished doing her arms after just one treatment. So IPL makes a huge difference if you use the right device and the right person's doing it. This will be easy for her to get through, and downtime will not be bad at all. So we're doing this just for pigment on her back. You may not be able to see it on the video as good, but she's got some little brown spots back here that she wants to remove. So we'll do the whole upper back here. We can do any area of the body with IPL. And again, this is pulse light for pigment, for reds, spider veins, sun damage. We can also treat acne with it. And I've really found that IPL, even though it's not like a laser as far as tightening goes, it definitely can help to smooth the skin and build collagen and keep the skin looking good. So, alright, so when we're done with this, we'll have done Total FX CO2 on our patient's face and neck, which she tolerated great. And then we did IPL on her chest and her shoulders, and we're finishing up with her back.
She got the red carpet.
She got the red carpet treatment.
It's